All right, folks, so the challenge continues to be that Jamaicans are not heeding the call for action. There's a misconception that once you feel well, then you are well. So the frequent question is, I feel well? Why do I need to go for a screening? Well, today for our 10 Minutes to Your Health segment, we are joined by Dr. Cathi-Ann Williams, the Non-Communicable Disease Risk Factor Program Development Officer.
Jeez, no, Dr. Cathi-Ann, you walk around with that title every day?
And wellness to discuss the importance. Actually, I just say CR here.
Oh my gosh.
Morning, welcome to Smile Jamaica. How are you?
Thank you, I'm well, thank you. Thanks for having me.
That is a big job that you have.
God.
So what do you do? What's your role overall?
I'm a Risk Factor Program Development Officer for Non-Communicable Diseases. So we get the information out about these conditions, diabetes, hypertension, cancers, and so on. We look at the risk factors for them, which we'll talk about, and we try to bolster the program so that persons know about it. There's public education, and there is a cue to action and change so that persons are healthy and well.
Okay.
Yeah, because really and truly, the sooner you know,
Yes,
is the more you can do about cancer for sure.
for sure.
Breast cancer especially,
For
prostate
sure,
cancer.
prostate, cervical cancer, colorectal cancer, diabetes, hypertension.
Well,
all
those
of
two in
these
particular at the
conditions.
end now, Doc, where we are predisposed as Jamaicans.
Right.
But the earlier you find it, is the more you can do about it, no?
Sure. Early detection saves lives. And so that's what screening is about. We're picking up conditions before persons probably have symptoms. They may have risk factors for it. Mommy had diabetes, daddy had diabetes, mommy may have had breast cancer, mommy's sister might have had breast cancer. And we're screening, we're testing early to try and pick up these conditions early, institute treatments early, and save lives.
Right.
What is screening?
Screening in medicine is testing for a condition before the symptoms even start. And it's about detecting conditions that might be present early before the symptoms start so that treatment can be instituted early.
Okay, so people hear screening and they think, oh my gosh, poking, prodding, I don't like this. How does screening usually happen?
Okay, it starts with a conversation. We talked about risk factors. So you go to your healthcare provider, find somebody that you trust and you're comfortable with, and we start that conversation. Did mommy have hypertension? Did daddy have high blood pressure? For the sons, did daddy have prostate cancer? Do you have risk factors for these things?
Are you
And we put you in a
predisposed?
predisposition. And so we put you in a category. Are you high risk? Are you low risk? And then the screening process is planned.
And the high risk
So-
and low risk would come out of the conversation?
Out of the conversation.
okay.
So based on the history, it can be added as well with some of the tests that we do. So if someone is overweight, for example, being overweight is a risk factor for a number of these non-communicable diseases. They can't spread from me to you, but they are present in persons and they're causing disability and they're causing death in some cases. So we do a BMI, someone is overweight, the body mass index. We look at their family history, we look at how they're eating, we look at how active they are, and we put all of these things together. We put them in a category and we do the necessary screening. Physical examinations, blood tests, some other prodding as well might be necessary, the
Yes.
physical examination. We look at the tests and we do a plan for wellness. We do a plan for screening in the future. Is it every year? Do I have to do it every 2 years based on my age? And we do all of that together. But screening saves lives.
Speaking about age, when do we start this?
Okay, so it will vary from condition to condition. For some of the
What you mean by I
cancers,
don't know what I have? I've just come in to screen.
Sure,
So if
so-
I'm just coming to check, how early should I start?
okay, so we look at your age. From children can start. So we look at childhood obesity. So we're looking at the weight for children in some cases. We're looking at our sugar levels as well in our children. For colorectal cancer, there are some conditions that predispose you to colorectal cancer, familial conditions, and so in some cases, even children starting at age 12, if they have a family history for some conditions, they can start screening at that time. For cancers, for example, for men, they start their prostate cancer screening. Normally, it's recommended at age 40. Or women do their pap smears screening for cervical cancer starting at age 21 usually.
21.
But for the high-risk persons, it's always a conversation with your healthcare provider. Screening may start early in some conditions.
Screening expensive, Doc? Is that why a lot of folks don't do it?
Screening doesn't have to be expensive.
Okay, let's talk about that.
Most of the necessary screening tests are available for free in your nearest health center.
Is that true?
Definitely. You can have your weight checked, you can have your blood sugars checked, you can have most of your blood tests done, you can have your pap smears done for our ladies, you can have
For
your
free?
prostate
Are
cancer
they
for free. For free. We're here to help. For those conditions that we don't have the coverage for, we can recommend you for it in the private sector, but most of the conditions, the blood tests, the examinations and so on that are so necessary for that screening process are available in your nurse.
Strange question, Dr. Cathi-Ann. I don't know if you're involved in these tests, but I was wondering, just thinking, listening to you, that how many people would feel, say, nothing go wrong with me, and I come for a screening and you find out, so no, sir, plenty things to write in this man. How often would something like that happen?
Right, so I'm also a medical doctor, so I see this happening as well. So persons come in, oh, I just want a checkup, and they may do their blood profile, their cholesterol is elevated, and I didn't know this, their blood sugar is probably at a pre-diabetic level, and we can institute these changes that will help. So you need to exercise more, you need to watch your sugar levels, you need to eat more vegetables and fruits. But it starts with the screening process. You see what's happening, people might be afraid, they don't want to know, but knowledge is power. It sounds cliche, but it's true.
It's true.
And as we said, early detection saves lives.
Yeah, that point is important. A lot of people opt not to screen because they don't want to know
find out
if something is wrong with them.
Yeah.
But if something wrong with you and you don't know, then
Absolutely.
Problem.
The earlier, the better.
when we talk about executive profiles, what are we talking about? And is that enough of a screening annually to check the box to make sure you know you're okay?
Okay, so most persons will find when they go, for example, to their private doctors, they get these sheets for their executive profile. So they'll do a number of blood tests, they will do stool tests, and there might be some indicators as well for some of the cancers as well that are tested for in the investigations. It forms a part of the recommended screening from the Ministry of Health and Wellness. There are sometimes additional things that we will add to that in terms of the full profile to ensure that the person has that full test done. But the executive profile is an excellent start. And some persons do the executive profile and don't realize that they're actually screening.
Right.
Some men are doing their blood work, they're doing their PSA, prostate-specific antigen test, and in so doing, they're screening and following up for prostate cancer.
And so,
Go ahead.
what would you add? You said it doesn't cover everything. They think
Okay.
something. Is that like the mammogram?
Sure. So I'll give an example. The mammogram, for example, is not on that form
Right.
that says executive profile, but it's a necessary screening test for breast cancer. For prostate cancer, the recommendation is both a prostate-specific antigen blood test and the digital rectal examination together as a screening for prostate cancer.
Aren't you
Very
due that
important.
soon?
Which is
Done
the
in the
question I
office.
was going to ask of just now. Why can't it be just a blood test? Now, I'm not saying anything, because I did it, and to be fair, it was, what's the word I want? Much less invasive than I thought it
Yes.
would have been.
Which one are you talking about? The digital?
No, the rectal one.
Digital rectal?
The digital rectal examination.
It literally lasts probably about 20 seconds.
Absolutely.
To be honest.
Absolutely.
But my question is, that's a fear that many of us have. Why can't it be just the blood test and the argument?
Okay, well, I'll answer that in two ways. One, our recommendations are based on the studies and recommendations of specialists in the field. They're called urologists, and they come together with all the other specialists and say, you know what, based on our population, based on what the data shows, we really need to have this starting with these two tests. So digital rectal examination, though a little bit uncomfortable, you can feel the prostate just in that moment. You can feel for nodules, you can feel for enlargements, etc. And you can have an idea of what's happening with the person even before the blood test
the blood
comes.
test can't do
The
that.
blood test shows the level of the chemical, the prostate-specific antigen, but that hands-on approach is very helpful in the
More
screening
precise.
process.
Can the blood test show that you have prostate cancer?
It can, but it works well with the digital rectal examination. So we recommend both of them together.
If the blood test does not show, does that mean that you definitely don't have it? Or
No, tests fail. Tests fail in similar. Digital rectal examination may not pick up everything as well. So both of them working together, the examination and the blood test work together and give you that assessment.
So your message to Jamaica this morning as we wrap is?
Screen, screen, screen. We have a theme. Check up, follow up, live up. Screening means early detection, and early detection saves lives.
Yeah. But I was tired after the opening. So Simone, when
Yeah,
did it close?
really. Let me take a deep breath.
Yeah.
Dr. Cathi-Ann Williams, the Non-Communicable Disease Risk Factor Program Development Officer for the Ministry of Health and Wellness. I never
You
sound
do
so
that
bad
so
when I
well.
say it.
Great to see you.
Okay,
Great to
it's
see
all
you
in
as
the
well.
phrasing
Thanks
there.
for having
God bless
me.
you and your
Thanks, Doc.
family.
God bless you
10
too.
minutes to your head. We'll do it again next Thursday.
Somebody with a shorter title, please.